Hello everyone, welcome to Dentospedia. We are delighted to introduce you to Dentospedia, the premier and the most comprehensive platform specifically designed to help you excel in your dental board exams. So today I'm going to teach you a short topic on luxation injuries. So let's get started with the topic. Luxation injuries are the trauma-related displacements of the tooth within the socket in the alveolar bone without actual loss of the tooth structure itself. The damage is primarily to the supporting structure, the periodontal ligament, the alveolar bone, and the gingiva. So see, first is extrusive luxation. So see, there will be a partial displacement of the tooth out of the socket. Will be a partial displacement of the tooth. Understand? Out of the socket. Are you getting the point? Now the tooth appears to be elongated. If the tooth is primary, then you have to extract if the risk of damaging permanent tooth germ. Understand? If you can see on radiograph that if it is impinging the permanent successor tooth board, then what you have to do? You have to extract the tooth. And if it is permanent tooth, then you have to reposition it gently and you have to splint it for 2 weeks. Do vitality test for at least 4 to 6 weeks. Understand? So you can see extrusive luxation. You can see the tooth is appearing elongated. Understand? It is partially out of the socket. So this is extrusive luxation. Understand? Now next is lateral luxation. So see, displacement of the tooth sideways, usually palatally or lingually or labially. The alveolar bone is fractured. Understand? Tooth is displaced, often firm and locked in the new position. Understand? So you can see it was the old socket and the tooth has moved laterally. Understand? So a tooth is displaced labially or palatally and locked in the bone socket. So if the tooth is primary, then you have to leave it if minimal displacement and no occlusal interference. If there is a minimal displacement and it does not have any occlusal interference, then you have to leave it. Otherwise, if it is impinging or if it is causing any type of disturbance to the permanent successor, then you have to extract it. Understand? If the tooth is permanent, then you have to reposition it digitally with a gentle finger pressure. Understand? Or orthodontically, and you have to do flexible splint for at least 4 weeks. Understand? So see, this tooth has been displaced palatally. Understand? So this is the example of lateral luxation. You can see in radiograph as well. This is a radiographic view of lateral luxation. Are you getting this? Now next is intrusive luxation. So see, when the tooth is pushed into the socket and it is a chance that there might be alveolar fracture. Understand? Displacement of the tooth into the alveolar bone, pushed deeper into the socket. Now the tooth appears to be short or is barely visible. Now the tooth will appear to be shorter. If the tooth is primary, then you have to allow spontaneous re-eruption. Understand? You should not do repositioning. Instead, you should allow it for re-eruption. If the tooth is permanent with an open apex, then you have to allow passive eruption. Understand? If the tooth is permanent with a closed apex, then you have to do orthodontic or surgical repositioning. Then you have to do RCT within 3 weeks. Are you getting the point? So it is the intrusive luxation. You can see in the image, you can see that it has been pushed down deep into the alveolar bone. Understand? So it is appearing short. Understand? And you can barely see this tooth. Understand? So it has been done alignment into the correct position with the help of an orthodontic wire. It has bring back to the correct position or correct alignment with the orthodontic wire. Understand? So it is a treatment of intrusion by orthodontic or surgical repositioning. Understand? So this is intrusive luxation. Are you getting this? So this was luxation injuries. So for detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.